context right now.
Okay, so I just want to say a big welcome to everybody at the conference today. And I just want to start off by introducing myself and the speakers on the panel to the plenary session. My name is Lisa Wood. I work for the Canadian Mental Health Association York Region South Simcoe as a Choices Program Coordinator. So I work with youth in schools talking about goal setting, decision making, alcohol, marijuana, all those topics to kind of prepare youth as they kind of go forward in their teenage years. I have over 20 years experience in the mental health field. I've also been a case manager. Anyways, and my goal really is just to provide resources as youth kind of go through their years, if there's any need for mental health resources and help. Obviously, it's been a very interesting year. Through the pandemic, the past year and a half or so, 1 in 5 15 to 24-year-olds often have felt depressed during the pandemic, which is actually a really high stat considering how many young people are feeling depressed and what can we do about that. So I just want to talk about today the importance of recognizing the needs of young people to service them better, which I'm sure our panelists will answer some of the questions that we have prepared, and just really emphasizing the importance of connection through the pandemic. And I'm positive some of the panelists will have some answers to that as well. And I'm joined here by 3 inspiring individuals who are part of our panel. Just to tell you guys a bit about how the session is going to go, it'll be a conversation between myself and the panelists. I'm going to ask some questions, and at the end, there'll be time for some Q&A. So I'm going to pass the microphone over as such to our panelists to introduce themselves, and I'll just go by the titles that I see here. So I'll just start off with Alex.
Hi, everyone. My name is Alex San Diego. I use she, they pronouns. I'm coming to you from Treaty 6 territory, also known as Edmonton, Alberta. I'm a recent grad from the U of A, and I currently work as the Youth Engagement and Communications Coordinator for Kickstand, where we are working to transform how young people in Alberta access health and wellness services. I also volunteer as Chief Marketing Officer for Asian Mental Health Collective. And personally, I have lived with depression and anxiety for almost 10 years, and I apply these experiences to my advocacy work every single day. And it's wonderful to be here with all of you.
That's awesome. Thanks, Alex, and welcome. And we'll pass the microphone over to Cindy.
Hey everyone, my name is Cindy. I'm from Mississauga, Ontario, but currently I'm living in Waterloo right now because I'm studying here at the University of Waterloo with a major in social development studies, a specialization in social work, and a double minor in HR management and legal studies. So in the past, I worked as a volunteer coordinator with Youth Mental Health Canada, but currently right now I'm just focusing on school, focusing on studying. And in my free time, I do volunteer as a peer support at the it's called GLOW, so it's like the school's GSA. So I just volunteer as a peer support there. And in the future, I would love to work as a clinical social worker. And I look forward to learning more about mental health and just like chatting with everyone today and hoping to learn more in this session.
That's awesome. Thanks, Cindy. I appreciate that a lot. And we'll pass it over to Stacey. Thanks, Stacey.
Thanks so much, Lisa. Hi, everyone. My name is Stacey Smith. I'm calling in from Fredericton, New Brunswick, originally from St. John, New Brunswick. I graduated last year from Dalhousie University in Halifax with my Bachelor of Science in Kinesiology, and I'm currently attending UNB for my Bachelor of Education in Elementary. I am currently the co-executive director of the Young Canadians Roundtable on Health, as well as the founder of the previously known COVID-19 Student Support Network, now the Mental Health Student Support Network. I've lived with depression and anxiety for the past 5 years, and then also use my own experiences and struggles to really advocate and help other youth that are struggling. So looking forward to the conversation today.
Awesome. Thanks, everybody. And thanks, Stacey, for your introduction. And we're obviously represented kind of across the country, which is really exciting. So different experiences in different parts of the country, which is great. So I'll start off with my first question or statement as such. So I was just wondering if some of you could speak to your journey with the mental health system, and just share with us some of the challenges that you've experienced. Do you want me to pick? Maybe I'll start off with you, Alex. I'm sorry if that's okay.
Sure.
Okay.
Yeah,
Awesome.
no worries.
Thanks, guys. Thanks, everyone.
So, I was first diagnosed at 18 when I started attending university. And that's because that was the first time I actually was exposed to conversations about mental health and had access to free therapy. And I'm pretty sure I would have been diagnosed much earlier and gotten help way earlier if I actually knew what mental health was before that point. And my experience with therapy through the university had been pretty good until the point where I started talking about family issues, and I ran into an issue where it was clear the person I was seeing didn't understand my relationship with my family and my culture. And so that kind of inspired my further work with Asian Mental Health Collective, and also inspired me to seek out a Filipino therapist. But this was all only accessible to me, after university. And so just my general experience with the mental health system so far is that as a student, I wasn't really able to access the services and the support that I really needed.
Mm-hmm, mm-hmm.
Yeah.
Okay, super. Thanks, Alex. And Stacey, do you want to share a little bit?
Absolutely, yeah. So I have a couple different experiences based on university as well as provincial. So I was also diagnosed with depression and anxiety back during my undergrad in 2016, just based upon some personal trauma that I had dealt with, as well as the stressors of university. That was about my third time trying to get my university degree at the time. So it was definitely pretty overwhelming, stressful. It was a decent experience. It was with Dalhousie at the time. At the time, I also didn't realize how bad it was. And I think even previous to my diagnosis, I definitely was having some struggles that I didn't realize were depression and anxiety. And I didn't know as much about it as well. And I think some of the supports that I needed were a bit more heavy, I guess I would call it. And recently, some of these struggles have popped up a lot lately. And back in Nova Scotia, when I was still living there, I tried accessing the provincial help. And I went through the process, you get your call back. But the biggest thing that I took away from that was the fact that my support worker that I chatted with to do my interview said I wasn't bad enough. And I found that to be really discouraging, because what right do you have to tell me if I'm bad enough or not? I'm the one reaching out for support. So provincially, I think, at least in Atlantic Canada, New Brunswick and Nova Scotia both have a lot of work to do. So that was kind of a discouraging experience, and I'm hoping that that it'll change in the near future.
Mm-hmm. Yeah, I'm sorry you had that experience, Stacey. That can be a real tough thing to hear for sure. Thank you for sharing that. Okay, and Cindy, do you want to share a little bit about your experience?
Sure. So my journey with the mental health system started when I was in grade 11. I went to my family doctor and spoke to him about symptoms of ADHD that had been there throughout my life. And he told me that because I did well in school and I got good grades, there was no way I had ADHD. These people who have ADHD, they can't focus, they can't do well in school. So that went nowhere. But then a year later, the same doctor, I went to him because I was having too many anxiety attacks. It was getting in the way of my life, and that's when he prescribed me antidepressants. I don't think he actually diagnosed me with anything, but he told me to continue taking the antidepressants, and I did for 2 years. And so for 2 years, the medication worked pretty well, I would say, but that was like the extent of my mental care help. It wasn't until the start of the pandemic, so 2020, when I started to go to therapy, when I felt like my mental health took like such a big dip, like antidepressants just weren't doing it anymore. Mm-hmm. And yeah, and I've been in therapy ever since. I really wish I started earlier. And I feel like the biggest challenge for me was that internalized stigma, like that came from not understanding mental health, not being educated on mental health. And that also came from like what healthcare professionals have told me about my mental health. And I'll elaborate on that in further questions. But definitely I felt that shame for taking medication, the shame for starting therapy, like I was being too dramatic, or that I was too sensitive, or that I should try harder to focus and like stop being anxious. So those were definitely the biggest challenges, but other challenges, I would say, again, like the medical doctors not really understanding mental health, increasing the stigma, being dismissive. And even I have had like a few bad experiences with my first therapist who just made assumptions about my like queer identity. So that was something that was really hurtful as well. And I'll elaborate on that in like further questions, but that's the scope of my experience.
Okay. Thanks, Cindy. And so kind of a theme about, kind of not knowing where to go for services and then being dismissed. And I think your experiences are quite common amongst young people. And thank goodness you guys have gotten the support that you have, but it's always a journey as such as well, to which I can hear from each of you speaking. So thank you for that. So we'll just kind of move on a little bit and we'll kind of get more information from you guys. How have the needs of young people changed? And this is kind of a two-parter. So what have you seen emerge and how can we better support young people after the pandemic? And what processes can we take from the pandemic? So I guess we'll start off with Stacey, if that's okay.
Sure, absolutely. I think the age of social media has been a big change for youth. Obviously, looking at different people online, seeing what their lives are like, that affects, their mental health. It's affected my own. No one tends to put things online that talks about their negative experiences in life or that they're having a bad time. They always just show the positive side and good side of things. So I feel like that's been a big thing that's changed and has really affected a lot of people. Mm-hmm. And obviously this global pandemic has been something that none of us in our generation have ever experienced. So I think that's, obviously been a very big factor in, the negative mental health, particularly around post-secondary students. That's an area that obviously I've been focusing with my support network. So I've seen a lot of people that are missing out on key moments in their lives. I missed my graduation, for instance. First-year students aren't getting the opportunities to have their first-year experience. So that really takes a toll. And it's really shown the gaps that exist in terms of accessible help, accessible mental health care. And that's kind of how we can better support young people, is to have the accessible mental health care, because there's long wait lists for free care. There's monetary issues if you want to seek additional care for more crisis situation. There just needs to be more accessibility for youth, especially youth from different populations, so Indigenous, BIPOC, those types of areas. So those are the things that we need to really take into consideration moving forward.
I would definitely agree, and to everything that you did say, and just touching on some really important things that have happened in the past year as well. So Alex, I'll pass it over to you now.
Yeah, definitely. In terms of change, I think in Alberta, at least, the attitude and stigma around mental health has really started to change and shift. Next year will be my 10-year anniversary from high school graduation. And like I mentioned before, no one had ever sat me down and had a conversation about what mental health is. And now I have, high schoolers that Kickstand we're working with that are super well versed in the topic, that approach me and ask me to come to their school to present for them. They're hosting all the mental health awareness weeks and months, and that's just something that wasn't happening 10 years ago. And so this, I think, is really positive. And again, it has also really been led by young people who are simply tired of how the status quo has been treating them. And so this does encourage more and more young people to reach out for support, which I think is great. However, there's still this really huge disconnect between youth who are now reaching out for support and then getting connected to the services that actually suit them. And so what we've seen from this pandemic are just so many creative and innovative ways of like Stacey's support network, for example, ways of connecting with each other and getting appropriate service to young people. And so, if there is a post-COVID moment, it will be important to continue to support those creative and innovative ways that young people are coming up with to make sure that the people around them get the support they need. And so whether that means supporting online platforms or partnering with people outside of the healthcare system, like your local library or Wi-Fi providers, yeah, we just need to keep supporting those innovative ideas that youth are coming up with, because they kind of know what they need best. So best to continue listening to them, I think.
For sure. That's awesome. Yeah, really bringing youth to the table and using your story as an inspiration. And I love the fact that you're being invited to schools to speak about your story and that they're well versed. That is amazing. Wow. So kudos to you and your group. Okay, so we'll kind of move on. So just kind of talking a bit about diverse communities, how do we engage them and really involve them in our conversations without overburdening them? How do we do that? What would be your take on that? And I guess we'll start with you, Alex, if that's okay. And then we'll.
Yeah, absolutely. I always say build time into your timeline. So I think that when we are doing regular work, we usually pick a deadline and then we build the timeline around that. And when it comes to engagement, especially when it comes to diverse or vulnerable populations, it's really important to build the timeline with that group, asking them how much time do you need, what times and dates work for you, and then deciding the deadline from that point. Because oftentimes I've experienced having a deadline pushed onto me as a young person who's being engaged, and then the process getting really rushed and then feeling really tokenized by the end of it. And so, yeah, really building that time so that you can create an actual relationship with the folks that you want to work with is, I think, a really key piece of engagement.
That's awesome. I love that. And Stacey, we'll go to you now.
Absolutely. I feel like the biggest thing is when we engage any communities, whether it's diverse communities and populations or not, they need to know that the advice they're giving and the information that they're providing to make change is actually going to be used. So I feel like just, ensuring that you're following up with them so that they know that the things that they're saying are actually going to be taken into consideration and that their voices are being heard. Because if you're not doing that, there's really no point in having these conversations. And they're going to feel like, what was the point of me even talking about it? So I think that's something that always kind of happens a lot with any engagement opportunities and any that I've been involved in. We always try to make sure that we follow up and tell them, so this is the change that you made because you discussed these points, you recommended these things to happen, that it made a change. So I think that's something to really keep taking into consideration.
For sure. So just not that tokenism or, I always find young people are actually really busy and a lot of people don't think they are. But so just being respectful of their time as well. That's awesome. So Cindy, what would you like to add?
Yeah, so I would say a really big aspect of engaging diverse communities is not putting pressure on them to engage and not expecting them to educate other people about their struggles. Like depending on what sort of program they're a part of, it can be really triggering to talk about their experiences, and it can be emotional labor to try and educate other people and to try and be engaged. So I feel like it's important to create that space to invite participants in without expecting that they will be there and they will be sharing their experience and educating and all of that. And I feel like another important aspect is, I feel like this applies to pretty much all communities, but especially those vulnerable groups, as we're discussing, is when you accidentally say something hurtful, it's important to listen to their experiences, try to understand where they're coming from, try to understand why it's hurtful, rather than focusing on yourself and making excuses and be like, oh, I don't see how it's that big of a deal. I just don't understand. That wasn't my intention. I have good intentions. I feel like when we put communities through that experience, it's really hurtful, and it just pressures them to say oh, it's not a big deal, it's fine, and just try to minimize their pain from what you have said or done, when I feel like doing that just kind of increases the disadvantages, the stigma, the misunderstanding. So when those hurtful events do happen, it's very important for all of us to try and learn from them rather than defend ourselves and make excuses. So I would say those are the two main things.
That's awesome. Yeah. So kind of, we're all going to make mistakes, right? In our journey, regardless. And, you know, just being that ally and being really authentic, I guess, too, with the groups that you're working with is really important. Okay, that's fantastic. So just what are some of the barriers you or other young people have experienced when it comes to accessing care? And I'm really curious to hear your answer about some barriers that you've experienced. So we'll start off with Stacey.
Absolutely. I feel the biggest thing for me has been affordability. You know, there's a lot of free services out there, and again, the wait lists are so long, and sometimes it only will really help people who might only be mild or moderate, but sometimes you need that, you know, severe care, which is something I've had to have. And I feel like it's just been hard to afford that care because it's with a psychiatrist, a psychologist, and those fees are expensive. And as students, we only have so much covered under our insurance plans, and we only have so much money. We're always on a budget. So I think that's been the biggest barrier for myself. And even like I mentioned, my experience in Nova Scotia with being told I wasn't in a bad enough state. I feel like, you know, being judged for whatever state I'm in, whether they think it's not bad enough, they have a scale or something. I feel like that's been a barrier because that discouraged me to even want to reach out to anybody else to try to get additional help because I'm just not being taken seriously. And that's where, you know, things can take a bad turn.
Almost like that two-tier system and like how bad you have to be to get the services, right? Yeah. And that's so unfortunate because, you know, we're trying to get services for in the two-tier system. Okay. So Alex.
Absolutely. So I actually want to speak on Kickstand. We hosted focus groups with young people, including Indigenous focus groups at the beginning of our story. And so I wanted to share some of the barriers that like youth these days shared, since, you know, I'm kind of aging out of being a young person. So for youth 14 to 21, some of the barriers mentioned include misinformation, so not knowing when their problems are urgent enough to seek help. Something Stacey mentioned, stigma that one is not sick enough by peers and professionals. So that is an issue identified by Albertan youth as well. Lack of connection with the providers, feeling like everything's very transactional with the providers, cultural barriers, and then physical barriers to like unreliable internet, and then wait times and logistics, for example, trying to get to another town without a car, if you know the services are in that other town. And in terms of Indigenous young people, they also name barriers like toxic family environments, lack of motivation and energy, and past trauma making it difficult to break free to follow these paths to wellness. And so that's a little bit of the youth voice in Alberta, and what kind of barriers they're facing right now.
Mm-hmm.
Yeah.
Thank you. Yeah, you touched on one, even just transportation, like how do you get to where you need to go to, right?
Mm-hmm.
Can be a huge barrier for many. So thank you for that. So Stacey, we'll pass it over to you.
I actually just answered that question.
Oh, pardon me. Okay, I apologize. Oh, you did. Oh my goodness. Okay, sorry. Okay, there we go. It's all good. Okay, so over to Cindy.
Yeah, so I feel like a lot of great points were brought up, and I do agree, especially with the cultural barriers and not being educated on when you need mental health service. I feel like that was definitely my experience, the biggest barrier. Like most high school students, most university, it does get better in university, especially high school students, like they don't understand when to seek mental health care, how to seek it, like when you need to see a therapist, when you need to get your mental health checked up. And another big barrier that I personally experienced was like medical doctors not really understanding mental health and being really dismissive, which definitely increases the stigma and shame that young people feel when trying to access care. Like for example, something that I got from like a doctor at a point, I was trying to refill like my antidepressants and I couldn't book with my family doctor because they were all full. So I had to go to a walk-in clinic, and the walk-in doctor like looked at me. She was like, "You don't look depressed though. Like, I don't think you need this medication." So that was a really hurtful experience. And with the ADHD as well, just my family doctor telling me that like I do good in school, and because of that, there's no way I have ADHD. It's just like kind of feeling a really big barrier is feeling like to have mental health struggle, you have to act a certain way, you have to look a certain way, you have to behave a certain way, and if you don't fit that mold, it's kind of like you're disregarded and you're dismissed. And yeah, and even with my first therapist, she always identified me as bisexual, even though I don't put that label on myself. But because I have expressed I was in a relationship with a woman, I had dated men, and I'm really strict with the fact that I'm not bisexual. That's not a label I put on. Nothing against bisexual people. I just don't identify with that label. I'm really open about that. But just throughout my time with her, she consistently referred to me as bisexual, even though I was I don't have a label. If I do, it would be queer, and I'm not comfortable with labels. But just the idea that if you have certain traits, it's really common for even mental health professionals to make assumptions and try to put you in a box and try to label you. So I feel those are definitely really big barriers. But other than that, I do agree with all the points said before. I won't reiterate the fees, the long referral times. Those are good messages for sure.
Yeah, it's amazing how many professionals make assumptions about others, and how that can be such a barrier to receiving care and treatment, which can be really unfortunate in many respects that you guys have shared today already. So kind of moving on to one more question as such, and then we'll get on to some other things. If your mental health needs were met, what would the ideal system look like? So if your mental health needs were met, what would the ideal system look like? And we'll start off with Alex.
Awesome. Personally, very similar to what Cindy was talking about. Providers, not just mental health therapists, but physicians as well, who are queer and trans affirming, trauma informed, and have some kind of anti-oppression training. To try and find a family doctor like that in Alberta has been a huge barrier for me. Even now, I'm still trying to find a family doctor. And so it would be amazing to have a provider like that. When I think about my younger siblings who are still youth and currently in that transition age of 17 and 18, I think about them a lot. I think about how difficult 17 and 18 were for me. I really reflect on how important peer support and capacity building opportunities are. When I was unable to access therapy, what kept me going was peer support. Having peers that I volunteered with that understood what I was going through and still cared about me. And I find that now my siblings have access to social workers and therapists and psychiatrists. But I feel that if they had better access to peer support groups and opportunities that meet them where they are at their own pace to help them grow, that would really be the ideal for them and their care.
That's awesome. Yeah, peers can play a huge role in individuals' recovery, which is great. So yeah, thank you for that. And Stacey, we'll pass it over to you.
Sure. The biggest thing that I've been learning about a lot recently is integrated youth services, and how, having the different practitioners in place could really overall assist with, the path to recovery. It's a model that New Brunswick, I know, is looking into. I had the opportunity to be a co-chair on the report that went out looking into the youth mental health and youth suicide prevention services in the province, done by the New Brunswick Child and Youth Advocate. And it really, showed the gaps of what's needed, what's not being met right now, and what the government needs to do. So the biggest thing that came out of that was IYS, and I think that's a really ideal system. And peer support, kind of to what Alex said, it's such an important thing. And that's kind of what I've been trying to do with my support network, is having that peer support. Most students are going through the same thing across the country. So everyone can kind of relate to one another and kind of support one another, bounce ideas off each other of how they can get being used to online learning full time. We're all going through the same thing when it comes to that, when it comes to students. So I think that's the biggest thing. And back to affordability, I think that's the biggest key, is ensuring you can afford the care, having enough practitioners in place. So we're reducing, the wait time, referral time. There's so many different moving parts to an ideal system. So there's much work to do in the future.
That's awesome. Thanks, Stacey. I appreciate that. And Cindy, we'll pass it to you.
But yeah, I 100% agree with Stacey. There's just so many moving parts, so many things that ideally we would have in our mental health system, but we don't. And I feel like something that I would definitely benefits the current system is if we have medical doctors be more educated on mental health. And if that's not possible, it would be really useful if they had resources that they can refer patients to. So it's like if they don't have the mental health education, they can say like, hey, like, I'm sorry, I don't have that, but here is a list of local social workers you can book an appointment with, or even like crisis hotlines. Sometimes like that would be useful too. But it just feels like medical doctors are the people that like youth seek first in terms of healthcare, mental health related. And it'll be nice if they were more aware of mental health. And on top of that, it would like, this is probably asking for too much, honestly, but an ideal system, it would be amazing if we had insurance coverage for therapy. It really would. Like, I feel like full coverage is probably not possible. I would hope that it would be, but even like, I don't know, like $500 a year for youth, like, or just for everyone, either like ideally, like that would be amazing. But again, like I understand like that might be like too much to ask for just like where we are at right now. But I feel like that would be amazing if it were possible.
Sure, I love that idea of giving, $500 a year to each youth and see what you could do with that in terms of accessing services, right? And what they say, reach for the stars, or there's some statement, go for the highest you can go, right? So use your voices to kind of achieve what you can, which I think is so fantastic. Okay, so what are some of your thoughts, I guess, kind of as we're moving forward? We've talked about a lot of different things, a two-tier system, kind of getting access to supports, some of the amazing things you guys are doing already. And have had so much success. What about the importance of networks of support during the pandemic? What are some of your thoughts about that? Again, so many people were so isolated during the pandemic. So we'll start with you, Alex.
Yeah, definitely. I guess something that really comes to mind is my work with Asian Mental Health Collective. So how I learned about them is they actually have a Facebook group called Subtle Asian Mental Health. That I was just kind of a part of, but I never had posted. And there's 55,000 Asian people from all across the world that are in there talking about mental health, that are supporting each other. And during the pandemic, I decided to start posting and having people really, validate my experiences, to say, I know what you're going through. And yeah, just having that network of support, I think, has been really amazing. Getting to work with people who really do understand your experiences, validate you, and make accommodations when you need it. I think that's been really important. And I guess when it comes back to that peer support piece, like it's just my wish, I guess, that every young person has that network of people who are open-minded and don't invalidate their experiences, can have that no judgment zone. And it sounds like, that's, of course, they should have that, but unfortunately, that's not the reality. And so I guess through my work and through the work of other folks, in this session, that's the kind of space that we can create for young people in Canada together, hopefully.
Yeah, awesome. What a great story of a positive social media experience. Wow, thank you for sharing that, especially during such a time of isolation.
Yeah.
Thank you. So Stacey.
Yeah, this is kind of going back to my support network, trying to connect with one another across the country. We're all in the same boat when it comes to that online learning, being isolated from our classmates or friends, having to, be in tough situations at home when we're used to being able to leave. That's why it's so important to be able to network with one another and just provide that support. I think a lot of them kind of popped up during this pandemic, a lot of people really wanted to help one another. And I think that's been really important. The biggest thing that I think is important that hasn't really happened is the support of universities with some of these different supports. That's been the biggest struggle with my support network, is getting the support of the universities. The biggest feedback I get is, we're an outside source and they want to make sure that there's no harm done to their students, which is totally understandable, but we're not a crisis line. We're not saying we are. We're not trained. We just want to provide resources and a place for students to just chat with one another. So I think it's important that we have the post-secondary institutions actually support us and take us seriously, because we're the people that are going to be here in the future. So I think that's really important.
Yeah, again, that peer support and really letting people that they're not alone, right? It is a big thing for sure. Okay, thank you. And Cindy.
I feel like building on what Stacey and Alex were saying, during the pandemic, like especially during quarantine, a lot of people were isolated. We weren't really used to not being surrounded by people all the time from school and work. Like that was our norm. We didn't even realize it was our norm, but once it was taken away, I feel like a lot of us were forced to reflect on ourselves and realize things about our life and our relationships. And that is really overwhelming, like having all that time to think. I saw like a lot of my friends and like peers and other young people just go through that process of realizing so much about themselves. And when you're going through that, like definitely having that support network to talk out your feelings, to just validate your experiences, it's so valuable. 100%. It helps get you through the isolated months and months and months that we were going through. So yeah, like even like outside of the pandemic, I do agree peer support is so important for all of that.
For sure. Yeah. And I like how you said, what was the norm before, prior, and then how it all got taken away from everyone was really difficult. Okay. So we've talked a lot about a lot of different things. What advice would you guys give to policymakers on how to better engage youth and ensure services are culturally diverse? And we'll start with you, Stacey.
Absolutely. So this kind of goes back to the experience I had working with the Child and Youth Advocates Office in New Brunswick on the taking a look at what youth mental health services and youth suicide prevention services, what they're like. Unfortunately, back in February, Lexi Dakin took her own life in Fredericton after receiving inadequate care at the Chalmers Hospital. So I think that really kind of opened people's eyes that mental health care is not adequate in this province. So I think in terms of advice for policymakers is to listen to the youth and make sure their voices are being heard. You don't want another tragedy like this to happen again. And it has happened repeatedly. They need to ensure that the youth are being followed up with, like I mentioned earlier when we were chatting, to ensure that what they're saying is actually being taken into consideration, is actually being used to make change. And when it comes to, ensuring services are culturally diverse, you have to make sure that you're bringing all kinds of different people to the table, different age groups. I'm also kind of coming out of being youth right now, ensuring there's representation from BIPOC youth, from youth in care. You just really have to have that, a little bit of voices from a little bit of everywhere to be sure that you're not going to miss the mark when it comes to making a new policy.
That's awesome. And Alex, do you want to share?
Yeah, absolutely. I would say it's important to engage several folks from that community with various levels of expertise. So just, for example, like just because I'm Asian or a young person is Asian doesn't mean you can invite them to the table and expect them to be an expert on all matters impacting the Asian community. I myself, I might know a little bit more because I studied Asian studies or I advocate for the Asian community and I've done it for a while. It's important to remember that when engaging other groups, because someone, again, to feel that tokenization if they're the only person from their community at the table and now they're being asked to represent on all matters related to that community. And it doesn't make for building meaningful programs or policy. Like you're only going to get one side of the matter. And so in order to get really a meaningful, nuanced engagement experience for that community, for your policy or your organization, definitely having multiple folks with varying levels of expertise, I think, is really important.
Yeah, hearing the voices of all is really important, right? Yeah, for sure. Okay, that's amazing. Okay, so there's lots of folks in the room here that obviously work in different mental health services. So using your experiences, what advice would you give to those of us that are delivering mental health services? And we'll start with Stacey.
Yeah, so I feel like just we need to keep everybody, in mind when we're, wanting to deliver these mental health services, ensuring that they have the appropriate training. I think is the biggest one, because some people don't know how to work with certain populations, whether it's young people, even older adults, you might not have that experience. So I think ensuring that the proper training is in place so people in the emergency room know where to direct someone if they're in crisis, the proper questions to ask, and then, whether they need extra support or whether they can go home. Lexi Dakin was sent home that day, and then a few days later, she passed away. So I think that's a prime example of, ensuring that the proper training is in place so they know the signs, they know where to direct people, they know what state that they're in.
For sure. And if they don't know, they'll inquire and find that out for you too, right? Yeah. Okay. Thanks. Yeah, thank you. And Alex, what would you say?
Yeah. Sorry, my Wi-Fi went for a moment there. But I would say when it comes to the young people that we have engaged with, they actually did provide a list of important traits for good support people. So they're really looking for people who are patient, supportive, understanding, open-minded, genuine. And I think I did see a question come in about what does it mean to access services that feel transactional? It means that, young people can tell when, they come into, your office or into the hospital room, the examination room, and they can tell it's a day where you feel like this is just your job and you're not interested in getting to know them and building a relationship with them. They can feel and sense these things. And so really building that rapport, that relationship with young people who probably have experienced some kind of trauma in order to bring them in front of you that day. I think that's really important. They're really just looking for a patient, warm space to go, and a person to talk to. And so kind of maybe putting down some of those like clinical background aspects and really, letting the personal relationship kind of take over, I guess. Yeah.
Yeah, just really listening. And what I say, listen and listen again, right? Yeah, for sure. Okay, and then Cindy.
Honestly, I don't really have much to add on for this question, just because I feel like both Alex and Stacey did a really good job, and like they said what I was going to say. But yeah, I really liked like Stacey's answer about building that sense of connection with the people that mental health providers deliver the services to. I feel like that to me would be like the number one most important thing, because it's so easy to just kind of feel like you're another patient in the waiting room and the provider's trying to like rush you through the appointments and like not really listening to what you're saying, and that is just really discouraging. So yeah, I would say that's like the biggest thing, just to emphasize on what was already brought up before.
Okay, super. Thanks, Cindy. Okay, what advice would you guys have for young people? And we'll start with Stacey.
I think the biggest advice is two things. I think number one, that you're not alone. A lot of youth, a lot of young people are, going through different mental health challenges, and that there's somebody out there that's probably feeling the same way you are. So you're not alone in this. And, don't be afraid to ask for help. I know obviously we're talking about our negative experiences with access to the system, but there is some sort of support or help out there for you. So don't hesitate to reach out to somebody, whether it's just another really close friend or family member, and then they can help you find the right support you need. I think that's something to really keep in mind. Just don't be afraid to reach out to start the process of getting the help you need, and then that process can start moving along and can get better.
For sure, that's fantastic. Okay, Alex.
Yeah, to any young people here today, I know that you are waiting on better.
Oops, I think. So maybe we'll go to Cindy while we wait for Alex to come back.
Yeah.
That we're not fast or good enough. You can like.
Oh. Okay, I think Cindy and Alex might be frozen.
Oh, I'm not frozen. I was just like processing,
Oh,
like, should I continue? Should I stop talking? But I think I'm good. I think.
okay, go ahead.
But yeah, I guess I'll just answer. So I feel like something that I wish someone had told me is that just because you have bad experiences with healthcare providers, it doesn't mean that they're all bad. And like Stacey said, it's important to just reach out. And unfortunately, there are times where you have bad experiences, but it's it's important to also not give up then, just because unfortunately that is kind of normal to have those unpleasant experiences, but it doesn't mean that like there isn't a provider out there for you, and it doesn't mean the help is not available. It just sometimes it sucks to go through the process. And I feel like something else that I really wish I knew that I would probably tell my younger self is like it's important to set boundaries and like understand what's in your control and out of your control and what's your responsibility and what's not your responsibility. I feel like that's especially important when you also have friends who are struggling with their mental health as well. You can be there for them as a peer support, but ultimately it's like their mental health is not your responsibility. You can't really make their like depression or anxiety go away. And I feel like taking on that role is something that a lot of people do when they're younger because they just love their friends so much. But there's only so much you can do, and there's only so much that you can encourage. And that's really unfortunate, but I do wish I learned that a lot younger.
I hear you. Yeah, and I really like that about, don't give up hope, right? Of trying to find some support and the right supports. And Alex, you kind of got cut off there
Yes.
midway. You want to continue?
Yeah, absolutely. So I just wanted to encourage young people who are watching today that if they feel that they can do a better job, they probably can, that they can lend their voice and leverage their experiences to support the process of making mental health services better for young people in Canada. I recommend looking for a group to volunteer with, whether it's on campus or in your local community. You can either plan events around awareness or join a local youth council to help influence policy. And just from my experience of allowing my most difficult times to push me to find like-minded people and organizations, that led me to advocacy and public speaking, but it also led me to lifelong friends who continue to be part of my support network. And so I really hope that you have the opportunity to discover the power that your voice and your experiences have, because I think that will really help you have positive mental health as well too. Yeah,
That's awesome. That's huge. The power of volunteering and using your voice, right, is so key in many aspects. Okay. So just kind of moving on a little bit. What do you guys want to talk about or have an input on the importance of collaboration and partnership? And we'll start with Stacey.
Yeah, I think collaboration and partnerships are very important because, we're all trying to make the same change, is to improve the mental health system, not even just provincially, but in the country, because there needs to be a more coordinated response because some provinces may be better than others. I haven't heard about that. I'd love to hear about that being the case, but I think it's really important to have positive partnerships, positive collaborations. I've had nothing but great things to say about CMHA. I've done some great collaborations with Frame as well. I always try to shout them out anytime I can. So though, having other organizations support your work, it just pushes you to want to keep going, to want to make that change. And I think that's why it's so important to collaborate and partner with others, because they can teach you things that you may not have realized. And you could also, help guide their conversations. And, a lot of the partnerships involve youth voice being heard and having input on different things. So I think that is another great positive thing from collaboration.
I love it. You never know who you're going to meet either, right? Which is pretty cool. Thank you for that. And Alex, what would you like to add to that?
yeah. I think a consistent barrier that's mentioned by almost like every young person, family member that we talk to is this confusing, disjointed, disconnected system that we're, tasked to navigate. And so that's why I'm excited at the prospect of many like amazing service providers and organizations in Alberta coming together under this umbrella of integrated youth services. But I'm also excited, at the prospect of integrated youth services in various provinces, coming together at a table to share knowledge and collaborate as well. Because like Stacey mentioned, they might be doing something that works in their jurisdiction. That might be a solution for us. And learning from each other, sharing that knowledge, I think is really important, in order to build a healthier Canada, I think. Yeah.
That whole knowledge exchange and just sharing your experiences is so important. Okay, so it sounds like you guys have all had your own experiences of not kind of knowing where to go for service. How would you comment on accessing services? What would be your advice, and I'll pass it over to Alex.
Yeah, I mean, low hanging fruit, I would definitely want to suggest supporting your local integrated youth services initiative, because it is a solution, one of many solutions to, again, not knowing where to go. If you have a brand name like Kickstand or a brand name like Foundry, okay, I don't know exactly what's going on with me or with my friend, but I know that if I go to this location or use their virtual services, someone there will have something for me, the right thing that fits what I'm going through right now, instead of access points like the emergency room, which definitely isn't the right service for everyone, right? And so yeah, I think supporting the work that IYS and similar creative, transformative solutions is going to be really important to making it easier to access services for young people.
Awesome.
Yeah.
And I'll pass it over to Cindy or to Stacey, pardon me.
Absolutely. Yeah. So yeah, I echo everything Alex said. IYS, I'm really hoping it's implemented more out here, out east, because it hasn't been yet. It seems like, Alberta and British Columbia have done fantastic work that way. So I'm hoping that's something that gets implemented here. And the biggest thing, I think, in terms of access to services, people don't know where to go. One example for post-secondary students is go to your advisors, go to student services, find out where to go on campus, off campus if you need support, so they always can help you. And if you're just, in your own city or something like that, the province always offers support as a kind of a starter. Even though I had my negative experience, don't shy away from it. You still could be put into the right hands. So yeah, those are the things that you can really do to seek out those supports.
Thank you. Thanks to everyone. Okay, so the theme of the conference is deconstructing normal. So what does that look like? So how do we normalize individuals' experiences and what that looks like? How do we kind of help them normalize it? And we'll start with you, Stacey, if that's okay.
Yeah, no, for sure. I think just realizing, normalizing mental health as has become more of a normal thing to have, I think, over physical health. Everyone I feel like, I don't want to speak for everyone. I feel like almost everyone has some sort of mental health struggle or difficulty. So just giving people the opportunity to share like this, share their experiences, stigmatizes it less. And, also shows other people that they're not alone, not just telling them, but you're also getting a chance to hear their stories. And I think that's really just allowing youth to have that platform to share their own experiences. And this will hopefully be seen by other people who are in policy, who are in government, and they'll realize that we have had struggles accessing supports. And unfortunately, that kind of sounds like the normal thing right now, but that needs to change. So I think that's really important.
Super. Thank you for that. And Alex, what would you like to add?
Yeah, I always say I like to use the power of communications and conversation to, apply that to my advocacy. And I think having more of those stories of mental health normalized, like instead of those more distorted depictions of mental health and mental illness in the media, I think that's really important. Supporting, those pieces that come out, like whether it's a movie or TV show, as well as using social media as a tool to share those stories, rather than using social media as a tool to further put on a mask or an image. Using it to be vulnerable and open and share a story, I think, is a great way to make social media a positive experience. And I think as well, just like what Stacey mentioned, inserting it into your normal day conversations, kind of the way we do with our physical health. And yeah, I think just having it be part of our everyday conversations is a great way to normalize it.
For sure. Yeah. Not make it so scary, right? To have those conversations for sure. So there's a lot of great questions in the chat, and I'm just realizing the time, it's 3:24. I think a lot of the questions in the chat have been answered in some respects, but one question I do want to ask, and you can answer this personally or answer it a bit generally if you like. And what signs did you or your friends or people you know of have in high school if you knew that you were struggling? So we'll pass it to you, Alex, to start us off.
Yeah, definitely. My thing was that I just assumed that being sad was a part of my personality. And I still find that now when I talk to folks in the community or young people, like, I'm just broken or I'm just a mess kind of thing is that's I guess kind of flag to me that something is going on. And I guess if you're trying to look for red flags in young people or are working with, definitely that would be one that I would look out for.
Okay, super. And
Yeah.
and Stacey, do you want to answer the question or?
Yeah, absolutely. Although, I wasn't diagnosed until university, I definitely feel like that whole sadness part, I had someone tell me, oh, you've always been a little bit sad, as almost a personality trait, but I didn't realize, that it might have meant something more than that. I feel like anxiety is something I've dealt with since I was a child, panic attacks and things like that. So kind of those small little things were definitely things that were pointed out to me. And I didn't really feel like they were something that meant anything. I didn't really understand the whole mental health realm at that point because I didn't really know that it was something that so many people dealt with, especially my family at that point. I didn't realize that was something in my family, that it was genetic. So just those small little things I noticed a lot.
Yeah, I totally hear you for sure. And thank you for sharing that. And Cindy, do you want to answer the question or do you want, I can move on. Do you want to go ahead?
Yeah, I can answer.
I wasn't go. Oh, there we go. I could. Awesome. Go ahead.
Okay, sure. I think the biggest thing for me and like what I notice is that like there are times when life feels overwhelming. There's a lot of schoolwork to do. There's maybe something in your life made you sad, and just that's part of the high school experience. But I understand it's really difficult to differentiate the normal high school experience, normal emotional experience with like something deeper, like something that you need mental health care for. So I completely feel like that's like a really hard thing to distinguish. And I think for me, and what I noticed is that it's not really something that people have a black and white answer for, but definitely the warning signs are just like losing interest in doing things. Everything just feels so overwhelming. The things that you like to do it seems stressful now. It seems like you don't want to do it. It seems like too much effort. And just like it's really little things like that. And even like losing your sense of self, that's something that happened to me. It's just like you kind of forget who you are. You're just so caught up with trying to survive and get to the next day and trying to process your emotions that you're just kind of like, wait, like what do I want? How do I feel? And if you can't answer that question, I feel like that is definitely something worth looking into. And days blurring together, also something. Yeah, just like everything just kind of seems so mundane and hopeless, basically.
I hear you. Yeah. And it's just everybody has their own individual experiences with how it affects them, depending on, all of our, that person-centered care is really what we should be implementing to help everybody. Okay, so we're kind of right near the very end of the panel. And I just have one more question kind of before we end. So how can we shake up the normal support experience for young people? Anyways, I guess we'll start off with Stacey. How can we shake up the normal support experience for young people?
I think the biggest thing is right now, normal is considered limited access to mental health care. And, there's no equitable access to mental health care, and people aren't taken seriously. And I think those are the big things that need to be shaken up and just thrown out the window, because those are the things that are making it difficult and are making it less likely that people will reach out for help. Although there's a lot less stigmatization nowadays, since a lot of organizations do a lot more advocacy work, there still is that stigmatization. So I think those are things that right now are still normal, and they need to be, you know, like I said, thrown out the window and show that that's yeah, they can sorry, I lost my train of thought. They need to be gone. They aren't normal things. They're really big concerns.
Awesome. I love it. Okay, and Alex.
Yeah, I think something that would really shake things up is similar to kind of what Stacey mentioned, is if we had actual universal health care that covered mental health care. You know, for example, with Asian Mental Health Collective, you know, we have a therapy fund where we offer, you know, free therapy to 25 members of the community, or, you know, through Kickstand with the funding, like we will provide free services. And that's good work and it's important work. But, you know, what if we could just access free therapy to begin with? I think that would be amazing. And there are lots of people here, I think, who can do that either through influencing policy or simply through, you know, your vote. And so I think that's something to keep in mind.
Awesome.
Sure.
So Cindy, do you have one more quick thing to add? Just in the sake of time.
Yeah, you're like exactly at time. I'll just kind of cut it short, I guess. I feel like what sticks out to me is like needing that educational reform, teaching kids from a young age like what mental health is, and that it is quote unquote normal, as in it's acceptable, it's valid to have mental health struggles, and everyone has different experiences. And a lot of people assume that when you go to therapy, it's kind of like you have like a horrible problem. Like it's like going to the doctor and have a broken leg. And I feel like that really shouldn't be the case. Therapy and mental health care should be like a regular checkup, like going to the dentist. You know, you don't have to have like something terribly detrimental going on. Sometimes that is the case. Other times it's good to just have that consistent mental health check-in and just normalizing that and normalizing the conversation about mental health from a very young age and just putting in our vocabulary and education. I feel like that is something that will definitely help deconstruct the stigma and what is considered normal versus unnormal care and mental health. Yeah.
For sure. Thank you so much for all of your answers. And my answer would just be to let people know there's hope and there is resources out there for them. I just want to say a big thank you to all the panelists for all of your answers to our questions, and just being so candid and honest and open. And all of your work has to be celebrated. So thank you for doing that. Thank you to all our participants for your questions, and for being here with us for the past hour. And a big thank you to CMHA for giving us a space to have this discussion. So round of applause for everybody here. Thank you again for your attendance. Thank you.
Thank you.